Hi friends, I want to say something about surgeoncut.com. Lot of doctors, surgeons, dental surgeons, other medical professionals world over have been regularly asking us for videos that YouTube doesn't like to show to people because it has a lot of blood content and it's the way we do surgeries. So we've got this website now up and about. You can subscribe, you can learn how we do these surgeries exactly. No editing, but in good clarity, 4K clarity. So all the best and thank you. Google, क्या भी दर्द है? नहीं है ना? हाँ वो पहले भी वहाँ से थोड़ा आपको ये हो रहा था डिस्चार्ज। ठीक है, have you taken a scan for her? Take a CBCT. And then we can probably schedule. We can get one other outside scan also done. Sometimes with this, the interference is too much. Check this scan. After that, if there's less interference, okay. If there's a lot of interference, send them out to get the scan. Then we'll see the scan and tell them the date. Call the guy. ठीक है, scan होने दो, आपको फिर बताएंगे. Mostly निकल जाएगा. लोगों को लग रहा है ऐसे देखेंगे. अरे क्या कर सकते, देखेंगे. पहले जब यहाँ से जा रहे थे आप तो सही था वो. उसके बाद से थोड़ा टेढ़ा हुआ है, देखेंगे स्कैन में. हो सकता है हल्का से ऐसे जैसे, बिकॉज ये बहुत टेक्निकली डिफिकल्ट सर्जरी है. फिर भी अगर मुंह खुल जाएगा तो
ऐसे रहेगा, मतलब प्रॉपर ठीक नहीं होगा.
शेप, हाँ शेप होगा ऐसे. अच्छा होगा शेप इससे. राइट. So here we have this patient. This was before we did the distraction osteogenesis, and this is now. You can see the date here. This is 12/6/2021. So it was the 6th of December last year, and this is the 30th of June. So it's about 6 months ahead. Yeah, you can show the photo also, and you can see the picture here. The huge improvement. Look at that. The facial proportions have improved tremendously. Yeah, she's got a lot of hardware, and this hardware is there because we have grown new bone inside the jaw with the help of these devices that you're seeing outside. This is what we call as an external mandibular distractor, and this is an internal mandibular distractor. Both are different companies. This is kind of custom made here. This one is a Martin one, and we have the distractor sitting inside on the bone, which you can see on the scan here. This is the same two distractors you see here. These are two distractors. So what these distractors basically do is, you can see the distractor here. We make a cut there on osteotomy, and then just get the two segments of the bone apart, and in between this area where the instrument or the device, the distractor is moving apart, there's new bone that's depositing. So this is basically a technique wherein we're able to create new bone for the patient's jaws especially, thereby giving that natural look eventually, thereby making sure that we are not going to use any permanent implants. And while the bone gets created, the soft tissue gets stretched, so there's much more tissue there for us to be able to manipulate with in the future. So now you see she has this ankylosis here. There's a mass, it's still there, it's still here. We're going to be distracting the jaw, and then now we're going to be clearing the joint by means of a temporomandibular joint surgery. ये साइड में ना, लेफ्ट साइड में आपका थोड़ा स्क्रू और गया है,
इस साइड पे
थोड़ा टूटा है, कुछ हुआ है?
नहीं सर, ये दांत थे ना इस साइड थे, ये खुद ही अपने आप ये बहुत बाहर थे, ये भी खुद अंदर चले गए।
नहीं, स्कैन में ऐसे लग रहा है जैसे कि कुछ टूटा है यहाँ से। देखो लाइन है, लगा है आपको धीरे से, कुछ पता नहीं,
सोते टाइम में सोती भी
तो उसकी वजह से वो मूव हुआ है, नहीं तो ये पूरा आगे होता।
सर अब ठीक नहीं?
नहीं नहीं, ठीक हो जाएगा, बस बता रहे हैं आपको, ठीक करेंगे। क्योंकि ना मैं पहले जो आप यहाँ से निकली थी,
हाँ जी सर।
वो स्कैन भी है हमारे पास।
हाँ सर, उस टाइम तो बिल्कुल ये शेप बिल्कुल एकदम।
हाँ, तो उस टाइम का मैं जो आपको दिखाता हूँ अभी, ये आपने 5 महीने पहले जो निकाले थे या आज का, मैं आपको दोनों लगा के दिखा देता हूँ। उसका जो हुआ है थोड़ा सा अंदर गया है। दिख रहा है? ये दांत आपका बाहर था
हाँ, ये वाला वाइट
और ये इतना ज़्यादा गैप था अंदर, तो वो लग के थोड़ा वो टूट गया है और अंदर की ओर भाग गया है। यहाँ से पूरा ठीक है। अभी फ़िलहाल क्या कर सकते हैं, कुछ नहीं कर सकते। लेकिन ये आपको मालूम है ऐसे कब हुआ?
सर इतना याद नहीं। एक बार छोटी लड़की ने ऐसे टक्कर मारी थी,
उसके बाद ऐसा हुआ?
मुझे इतना याद नहीं है, मुझे दर्द भी नहीं हुआ था, पर इतना उसने ऐसे उसका फेस बजा था मेरे साथ थोड़ा।
ठीक है, भी नीचे दिया हुआ है। तो अभी क्या करना पड़ेगा, ये प्लेट स्क्रूज निकाल के थोड़ा वेट करना पड़ेगा। तो सोमवार को शायद तो कर सकते हैं। अभी आप आगे के दूसरों निकाल देंगे ये सबको, लेकिन अभी पूरा नहीं हो पाएगा बिकॉज ये टूट के अंदर गया हुआ है। अभी वो वापस से सेट होना है और टाइम लगेगा, 3-4 महीना। अभी ये जो है निकाल देंगे सब कुछ, अभी इसका काम हो गया बिकॉज ये टूट गया, समझ रहे हैं ना। ये सब निकाल के सोमवार को
चलो सर्जरी फिर से नहीं करने वाला नहीं होगा
मुश्किल, वही बता रहा हूँ मैं आपको। आपने मुझे बताया भी नहीं, लेकिन उसमें हड्डी पूरा टूट के सेपरेट आया हुआ है, इसीलिए मैं अभी वेट कर रहा हूँ। लेकिन अगर बिना निकाले आप वेट करो ना, ये मतलब जमेगा भी नहीं, क्योंकि बीच में आ रहा है स्क्रूज, तो इसको स्क्रू निकालना है, तो फिर एक थोड़ा और टाइम लगेगा वो हीलिंग के लिए।
Hello everyone, I start with the pre and the post-operative comparison because A, we rarely get patients who can come back for a follow-up, She is one such a case, being a distraction osteogenesis for TMJ ankylosis repair. Hers is a stage treatment modality. I say stage, which has been devised by Dr. Richardson. It's because this is when she first visited the hospital. सर्जरी को लगभग 4 महीने हो गया आपको? दिसंबर को हुआ था, approximately 6 months, little over 6 months. When she first came to us, she herself is a nurse by profession and she knows what her condition was. It's called TMJ ankylosis, and that happened because of a fall in childhood. She says she visited multiple doctors but surgery कभी नहीं करवाई थी इससे पहले आपने. Right. So this is the first time when she came, an extremely retruded or receded chin. The treatment plan devised by Dr. Richardson was a growth in the length of the mandible, extension of the mandible in stage 1 by distraction osteogenesis. This is how the distractors look. Once we see the device, there is an external and an intraoral device. We will show the front view also to make you understand better. So this is how it's called an anti-gum appearance, because almost a non-existent retruded chin, along with the chin, almost a non-existent jawline. So the lower part of the mandible cannot be appreciated. Right now what she has is an external device, as I point out, to her left, and an internal device on the right, but it's coming out, the port is coming out through the center. So when she turns on a side, we see the growth which has been achieved on both the sides. This is through phase 1 called as distraction osteogenesis, which was mainly aiming at the lengthening the mandible or growing the mandible. Growth in her case was impaired or retruded, so as to say, because the condyles are fused. It's the joint defect, a TMJ, temporomandibular joint defect, which is there on both the sides for her. Stage 2 was planned for an ankylotic resection. Mind you, her mouth opening was not something which was dealt with round 1. So in her own words also, Preeta, thoda sa मुंह खोल के दिखाओगे? It's the same. But she says she can feel दांतों में फ़र्क आया है, वो समझ में आ रहा है, दांत आगे पीछे हुए हैं, and biting also is different now from what it was earlier. That's what the patient says. She stayed with the device in her jaw for about half a year, we can say, 6 months, because we were waiting for good bone formation. We had explained it needs patient compliance, patient cooperation for sure, but this was the best treatment modality that could have been achieved for her. Today she is going in for a round 2, which will help her in opening the mouth. We'll see, and also removing the distractor, because the purpose of the distractor was to grow the mandible, and that's over for you right now. So we'll see, Preeta, as to how the second surgery goes. उसके बाद आपके क्या इम्प्रूवमेंट आते हैं फंक्शनल, खाने में, स्पीच में, आपको अभी रॉड के साथ, क्योंकि सोने में भी दिक्कत होता होगा.
रोटी 6 मंथ से मुझे पता मैं कैसे खा.
आई नो, इसमें पेशेंट कंप्लायंस लगता है, एंड ऑल क्रेडिट गोज़ टू यू. आप समझते हो कि प्रोसीजर का इम्पोर्टेंस क्या है, इसीलिए आप कंप्लाई कर पाए उसके साथ. दैट इज़ इम्पॉर्टेंट. सो विल सी हाउ इट गोज़ इनसाइड द OT and also before she goes. Thank you. And she stays right in the northernmost corner part of our country, which is Jammu and Kashmir. So she's come right here in Richardson Hospital, this time for a secondary intervention. I say secondary, she's a case of TMJ ankylosis, and the first stage distraction was scheduled for her. By distraction we meant a bilateral distraction in her case. It was an extraoral distractor device placed on the left side and an intraoral placed on the right side. This has been removed at this stage. We are planning, Dr. Richardson is planning for another surgery, especially like a gap arthroplasty surgery, to increase the interincisal opening. That has been scheduled or planned for the next time. This second intervention is basically to remove the plate and screws. The first surgery, as she said, happened about 6 months, a little over 6 months for her. It was last year. It's fully अभी नहीं रुकेगा, थोड़ा सा सर पीछे रखा. हाँ, यहाँ पे भी. ठीक है, रुकूँ मैं. इस साइड से करूँ सा. इस साइड का ज़्यादा है कि कम है? सेम है. धीरे धीरे और थोड़ा सा इसको वेट कर दो, चलेगा? अभी ठीक है? करो अभी स्टार्ट। एकदम धीरे देखो। ये वाला पार्ट जल्दी निकालो। एक ही स्ट्रोक, लास्ट बाकी है। अब खुद अभी देखो, अब मिरर में देखो, कितना बाकी है, देखो कितना निकला है। यहाँ पे स्वेलिंग है आपको राइट साइड पे, क्योंकि यहाँ पे वो जो इंटरनल डिस्ट्रैक्टर था वो था, अभी निकल गया है, ऑलमोस्ट पूरा ही निकल गया बस। डिस्ट्रैक्टर नहीं है प्रीता, ऐसा दिख रहा है अभी? अब देखो, यहाँ पे भी रॉड्स थे और यहाँ पे रॉड था। ये जो रॉड था वो पोर्ट था और इंटरनल डिस्ट्रैक्टर, यहाँ पे स्वेलिंग इसीलिए क्योंकि वो निकाला है।
मतलब ठीक हो जाएगा ना स्वेलिंग?
स्वेलिंग चला जाएगा, स्वेलिंग चला जाएगा। आपको अब ग्रोथ अप्रिशिएट करो। देखो ये वाला पिक्चर देखो, दिस इज यू 6 मंथ्स बैक। नहीं देखना, नहीं देखना ठीक है, पर मैं दिखाऊँ बस कंपैरिजन के लिए, ठीक है? मिरर मत रखो। Her chin, she's jokingly says she doesn't want to look at this picture, which is a pre-operative her 6 months prior. As I said, she is a case of TMJ ankylosis and a nurse herself, so she knows her medical condition thoroughly. She came to us knowing the treatment plan, but Dr. Richardson evaluated, showed her the scans and said it needs a staged intervention. When we see stage, the first stage was like a distraction which was done, almost like a craniofacial surgery. This was the amount of discrepancy that she had. अब थोड़ा सा साइड में टर्न होगा बेटा। Yes, there is swelling on both the sides. That's because it's 5 days post the distractor removal. Stage 1 was with the distractor. When we say distraction, it's the body's own indigenous capacity to grow bone with the help of an external device. In her case, the external device, the external distractor was over her left side and the internal one was over the right. The internal one had a port, hence we see the stitches. This will be removed today. This was the amount of length or adequate bone which was required to give a facial symmetry or a facial proportion. If you can turn on your left, Preeta. Yes, there is swelling right now. That's because the distractor has been removed. But we see almost a non-existing jawline. The jawline is now exist. There is a chin. The chin was always there, but it was rudimentary, so as to say. That has been advanced. This was planned in stage 1, as I mentioned, the stage surgery. If you look up, yes, if she looks up, yes, stitches are there right now, but we see the jawline is existing, something that was very hard to appreciate 6 months back. She's a brave girl. I say brave because she has, the intubation for her is very difficult. Team of anesthetists have done a fiber optic intubation, not once but twice in her case. She was much calmer the second time. The third surgery or third intervention, so as to say, will be for increased interincisal opening. Something to do with the TMJ ankylotic mask. We see you, Preeta? Yes? Okay. Cosmetically, your facial improvement के लिए a lot has been achieved. You have tolerated, you have been with us through a lot ये 6 months में. But अभी आपका कैसा है, खाने पीने जो फंक्शनैलिटी है उसको भी एड्रेस करेंगे. उसके लिए ट्रीटमेंट स्टेज 1 है, तो स्टेज 3 में वो होगा. ठीक है? So we are looking forward to see you again.